My name is Meera Rana, and I'm a hematologist and oncologist here at St. Luke's Center for Cancer Care. So I did my medical school at the University of Medicine and Health Sciences. I completed my internal medicine training at St. Luke's University Hospital and my hematology and oncology fellowship at Wake Forest Baptist School of Medicine. I specialize in solid tumor diseases, including cancer of the breast, the lung, the GI tract, and prostate and kidney. I also have an interest in benign hematologic diseases as well. When I was young, I always dreamed of being a painter. I used to love painting, and then I quickly realized I was really bad at it. My stick figures were not going to cut it. And so more recently, I've actually developed an interest in photography. So hopefully one day I'll get pretty good at it, but I really do enjoy photography now. Somewhere around, I think it was middle school, when I started shadowing physicians in my hometown. And so there is a cancer center at a small hospital in our town. And so I was like, let's shadow the oncologist there. And so I went there not knowing. I thought it was going to be a very, sad day. Cancer, it's got to be sad. But I was actually pleasantly surprised. You see these patients in the infusion center, they are smiling and they are so strong and so positive. I remember looking up and thinking, wow, that's so admirable. Like, they're going through all this, but yet have more of a positive attitude than people that have more or less nothing going on. And I remember that resonating with me in that time. I was just like, wow, I really love this field. It's amazing. When you get to learn from your patients, that's pretty neat. There have been so many advances in treatment, and from providing cures and long-term remissions in patients that previously had little to no hope. While that all is fascinating, it's really the long-term relationships that I've developed with my patients over time that made me choose this field. Getting to know them and their family and being able to help them during the hardest time of their life really makes this job the best. So my philosophy is that with any cancer diagnosis, it is traumatic and scary. And my role with patients in general is to try to provide as much information as I can, answer all their questions so that at the end of the day, they can make the best decision for them. My patients would describe me as approachable, compassionate, and professional. I'm also really comfortable working with people from different backgrounds or ethnic backgrounds as well. So here I feel like we are a team providing patient care efficiently and quickly. You get the benefits of an academic center, but the feel of a community. You actually get to know your physicians, your nurses, and your staff, and I really think that's what makes this family special and unique. Symptoms can be pretty vague, but concerning signs or symptoms include fevers almost every day, chills, unintentional weight loss, noticing lumps or bumps anywhere, things that just don't feel right. So your physician will help guide you through this process, but important things to know is to try to understand what kind of cancer it is, what stage, how aggressive, and understanding those details. Many times you will be referred to see an oncologist, but there are certain cancers that can be treated with excision or surgery alone. And so it also helps to have a family or a friend at your visits too, and to provide support and ask questions. Some risk factors include heavy cigarette smoking, a lot of sun exposure, some chemical exposures in the past all can contribute. There's also risk for hereditary. If you know it runs in your family, you may be more prone to develop a cancer as well. It's important to know these things and try to protect yourself. And so if you are in the sun a lot, putting on sunscreen is always a good idea. Making sure you get mammograms on time, colonoscopies, and if you do have a history of smoking, it's always good to ask your doctor about low-dose CT scans to screen for lung cancer too. So depending on the type of cancer that runs in your family, it's really important to keep up with screening guidelines that may include a colonoscopy earlier than most people, breast exams, and mammography. And so it's really important to relay this to your physician so that we can make sure that you get the appropriate guidelines, lab work, imaging, and any screening that needs to be done.